And for more than 30 years, the Department of Veterans Affairs says they provided free health care for any illness or injury that they determine is related to a veteran's military service. It's something a former service member in Bryan College Station says was designed to treat mostly short-term problems. When COVID-19 hit, Veteran Affairs was tasked with tackling even more problems they could have even predicted. Back in March, President Biden visited a VA clinic in Fort Worth, saying that serving veterans should be a priority.
Every single solitary veteran deserves to be treated with dignity. They shouldn't have to ask for a damn thing. It shouldn't be, can you help me? It's, I've got a problem, and we should say, how can we help?
Back in December, a College Station veteran tried contacting his local VA asking for assistance, only to be met with mixed messages from his hospital and the VA's outpatient clinic in town. KAGS' William Johnson has been investigating this for months and walks us through what this process has been like from the very beginning.
For months, we've investigated and found that his case isn't as uncommon as you might think. But in his experience, he says he feels the hospital has done a disservice by putting a patient's plea on hold instead of taking the call to serve. Who do you think is really telling the truth here?
Honestly, I couldn't tell you.
Jason Scaturro spends most of his time working from home, either on his computer or making phone calls. As a veteran, he's been guaranteed free access to health care through the Department of Veterans Affairs after the agency was established in 1989. But in Jason's experience, he says the promise of protection has been torn for years.
I went to the VA back in December. I think it was December 22nd. They gave me a referral.
Jason joined the U.S. Army's Military Police Corps in 1995, serving for 13 years in areas like Washington and Germany until 2008, when he was discharged because of an injury. Fast forward another 13 years, and Jason says he was experiencing pain in his foot. So he contacted the local VA, asking them for a referral so he could be treated. A referral, he says, was sent to the local hospital.
They faxed it over, have confirmation they received it. Said give it 24 hours and call them back. That's what I did. I waited 48 hours instead of 24. Called Baylor Scott White. We don't have it.
A series of emails and calls he repeated between both the VA and the hospital, waiting for a response for weeks. When he finally got an answer, he says he had to start the process all over after an alleged error was found on the paperwork.
I was told this time that apparently they rejected the referral because of the doctor's name that was on it.
The doctor listed is a podiatrist who currently works for Baylor Scott White out of Temple. At this point, Jason says he had already called the VA and Baylor Scott White College Station on 3 separate occasions without an answer on what to do next.
I could just go, okay, well, I just want to use the VA and I'll just get my own medical insurance and run that way. But I earned this.
Scaturro says he was in contact with Tom Walker, the administrative officer over the VA's local clinic in College Station. So we called him, and after a brief conversation over the phone, Walker directed us to their Temple office, who wasn't able to provide an interview, but released a statement apologizing for Jason's struggles, stating in part, "We apologize Mr. Scaturro has had difficulty with his community care referral. In an effort to protect patient privacy, we cannot comment on a specific veteran's case, but we have made contact with him directly and Baylor Scott White to make sure his questions and concerns are addressed." According to emails provided by Jason, Tom Walker stated he had sent the referral over to Baylor Scott White College Station, but said in part it's not at all unheard of for those authorizations sent by the CITC office and get lost at Baylor Scott White. When Jason called the hospital the next time, he says he started to finally have hope that he says now was short-lived.
When they transfer you over to referrals, they are very defensive and insist that it is your fault that this is not going through how it should be.
Even now, Scaturro says he still remembers the conversation.
You're doing it wrong. That's all she kept saying. That had me pretty heated. Basically, she was implying that I didn't go see a doctor. I just tried to get an appointment at a specialty clinic without a referral at all.
It seemed like Jason was facing obstacle after obstacle, and it was starting to seem like a lost cause.
This makes me emotional. It's not the VA. It's not anger. I have a tremendous amount of pride.
But if his time in the military taught him anything, it was to never give up.
I said, ma'am, I went to the VA The VA is referring me to you. No, you're doing it wrong. And I said, ma'am, somebody there needs to call the VA and tell them this.
Jason says instead, the conversation stopped and that the hospital had hung up the phone. We also reached out to Baylor Scott White College Station asking to hear about Jason's case. By the time we arrived for Jason's interview, less than 24 hours later, he says he received an email from Tom Walker, the administrative officer at the VA, who explained he had hand-delivered the referral to the head of podiatry over at Baylor Scott White College Station, something that Jason says he didn't have to do. Soon after, he got a phone call, a call back he'd been waiting months to receive.
I had five or six phone calls from Baylor Scott White that day. Now, after the media's got involved, now they've got me an appointment, amazingly enough.
From the calls with the hospital, Jason says he finally got set up with the hospital. But after finally thinking he was getting the help he was waiting for, one of those phone calls was different.
One of those 6 phone calls that I received yesterday, which would have been the 23rd, was from someone else who insisted that this whole problem was my fault.
The day after we first contacted Baylor Scott White College Station, they agreed to a sit-down interview to discuss Jason's case. We even asked Jason to sign a HIPAA release form with the intention of being able to discuss his medical history with the hospital, something they requested before our interview. The guest services director, Kendall Parker, says the hospital regularly sees veterans looking for care.
It's always nice whenever we see a veteran entering our facility to where we know that they previously had to go to Temple or to a VA hospital, and now they have been afforded the opportunity to be able to come to us.
Parker's department regularly assists guests navigating the hospital.
Having our guest services team there to greet them, to answer any questions that they might have, or even if it's just for them to walk them to where they need to go.
But when asked specific questions about Jason's case, the hospital's communication staff told us that Parker wouldn't be able to comment. Can you walk me through what the medical referral process is like when you work with the VA?
So that's probably something that is not in Kendall's wheelhouse. Correct me if I'm wrong.
Right.
When we mentioned about Jason's phone calls to the hospital, we were met with the same response. Each time he's called, he said that y'all never received a referral. I'm just kind of wondering what that is. Can you comment on that at all? Or
That's probably another one that just, Kendall hasn't been involved in his case at all.
After our interview with Parker, we called Baylor Scott White again to see if speaking with the referrals department would be possible and finally get answers to the questions we had asked. In March, we were told in an email that they weren't able to provide anyone for our interview. A month later, we reached out again, asking to speak with someone. We were sent this statement. From the time we were made aware of this concern, our team worked to help, and we are pleased that it has been resolved. We are always working to make care more convenient, and Baylor Scott White Medical Center College Station is pleased to offer a whole team of individuals dedicated to assisting patients with their care journey. To this day, we still have yet to receive answers on Jason's case from the hospital, but for Jason, it's a battle he says he hopes not to fight again. It's something he says he wanted to see through to the end.
I'm just a man who fights for what he believes in.
A man who has served alongside the thousands of men and women who've put their country before themselves, with some whose challenges follow them outside of the battlefield. Jason says he just wants other veterans to never give up when it comes to their medical care, no matter how long it takes.
They deserve better. And if my fight helps him get it, then I'll fight it.
On March 2nd, Jason was finally able to receive treatment after we contacted Baylor Scott White College Station asking about his case. We asked Baylor Scott White what they were doing to correct the issue going forward. We asked what specifically happened that caused this to be a problem in Jason's case. As of today, we still haven't been provided answers to these concerns, but we'll continue to follow up. I'm William Johnson with KAGS News.
Beautiful story, William. And Jason says he's not the only former soldier fighting this battle. If you're a veteran and struggling to find assistance, email our newsroom at the email below. We're listening.